So good afternoon, everyone. Welcome back to the Dean's Leaders in Lagniappe Lecture Series, where we welcome public health leaders to share their innovations, ideas, and leadership values that got them to where they are today. As we get started, I want to briefly ground us in the work that we're here to address and in the land that we inhabit. The city of New Orleans serves as a continuation of a great indigenous trade hub known to the Choctaw, Homa, Chittimanga, Biloxi, and other native peoples as Belbacha, the land of other tongues, the place of other tongues. For thousands of years, people have lived along the Mississippi River. Our city served as a place for diverse cultures to come together. New Orleans today is situated in the American South, historically and presently the epicenter for inequities in our nation. If we are to make our world a more equitable one, we must include and center the places and communities subjected to the greatest inequities, in part because the solutions we seek live in these exact communities. The origins of the lecture series come from a school-wide desire to give our students the tools and experiences needed to become the next wave of innovative leaders. Through these opportunities, we meet and learn from some of the most distinguished leaders in public health. We aim to build a bridge between our future leaders and our current ones. The lecture series also boasts something distinctly New Orleanian: Lagniappe. Lagniappe is a concept you'll find throughout South Louisiana and is the idea of adding a little something extra or unexpected to an occasion. We have adopted this concept of Lagniappe by incorporating the arts into the public health lecture series. Our current exhibit in the DeVault Gallery, I Gotta Tell You Something About Me, is a group exhibition in collaboration with our Center for Youth Equity within the Violence Prevention Institute here at Tulane. The portraits you see are original artwork from 16 young artists from New Orleans, aged 11 to 21, and reflect the experience of youth in our society, how they define themselves, and what they need to thrive. I encourage you to take a look at the exhibit after this lecture if you haven't had a chance. And now let me introduce this month's speakers. Dr. Daniele Fallin joins us from Emory University Rollins School of Public Health, where she joined as Dean in 2022. She is an internationally regarded researcher and educator, having led multiple CDC and NIH-funded projects regarding how environments, behaviors, genetics, and epigenetic variation contribute to the risk of psychiatric diseases. Also joining us today is Dean Bernadette Boden-Albala. She is a social epidemiologist, professor, and founding dean of the University of California, Irvine, Joe C. Wen School of Population and Public Health. For more than 25 years, she's dedicated her career to promoting health equity for all, defining and intervening on social determinants of disease, and leading community-level health assessments and solutions. Thank you both for being here today, and I'll turn it over now to Bernadette, who will begin.
Great, thank you so much. It's really, it's a pleasure to be here. Let me see if I can get my, and it's really, it's kind of fun, kind of interesting, and actually terrifying to say, oh boy, what are my leadership roles? What are my values? What's my philosophy? And what have I been doing for the last 25 years? And, but it's really good, and everybody should spend the time, and I thank you, all of you here, for inviting me to have that time of reflection. And today I really want to talk about vision, agility, and community as I reflect on where I started and where I have come. And I'll just say I have, I think, two things. One, we've had really tough times in the last 5 years, more so maybe than in the last 20 years. And I think as I reflect back over the last 5 years and really the 25, 30 years of my career, the most important thing I can say is just keep walking. And I think just don't sit down, keep walking, move through it, you'll find a way. And when we think about just keep walking and how do we just keep walking, we need to have vision and we need to have passion. And I think that my journey really begins with both of those things. And for the first couple of slides, I talk a little bit about the then, where I started, and we had a lovely chat with some faculty earlier this morning. And I think that the term social epidemiology wasn't even a term at that point, but I didn't do just biological epi, right? I was really very interested in sort of the context within which disease occurs. And so thinking about how to do that and switching from sort of stroke epidemiology, which was one of the things that I had started doing, and thinking about, but why would there be differences by, say, race, ethnicity between, and I was in New York at Columbia University, between Latino communities, between Black communities, between white communities in this northern Manhattan area, and really understanding, is this biological? No, this is really more social. And so I sort of gravitated to this whole role of social epidemiology. And even in my doctoral, early or late doctoral years, and working through a thesis, thinking about something as simple as, how do I capture the true incidence of stroke in this multi-ethnic, multicultural, very rich and vibrant community? Because, for example, not everybody comes to a hospital who has a stroke. And so how do I understand what the experience of stroke is? And I asked my mentor, who was very famous, Bruce Link, and also Ralph Sacco, how do I do this? And they're like, just go into the community. And this is way before we really started talking about community engaged research. Go into the community and try to get a sense of what's going on. And so I take you to what is now and you can see, this is kind of my roadmap for equity. And while I started this roadmap in thinking about how do we describe issues of disparities and how do we think about moving towards equity, and along my whole career, I've kind of added these different kinds of working groups and these different kinds of focus areas to it. And so when I started my career, it was really just about identifying risk factors. Was there a difference in morbidity and mortality between white communities, Black communities, and Hispanic communities around stroke? But in order to think about those risk factors, we needed to talk to people, we needed to engage people, we needed to engage communities, we needed to engage faculty and staff and business owners. And then we needed to start thinking about how to describe those things. And then what of those things, and the term social determinants of health, I know we know it, but it hasn't always been around, right? SES was originally around, and even before that, it was other factors, demographic factors, right, going all the way back. And so how many of those things that when we're describing disparities are about underlying social determinants, and what does that look like? And then I think more recently, and I'm going to go to stroke, I'm talking about stroke, but thinking about all of public health, but wait a minute, these aren't biological factors, and we just can't give somebody a medication to treat them, so we have to move further. How do we do that? Who do we do that with? And thinking about all of the stakeholders. And then how do we optimize that, right? Well, we optimize it by working with people in communities who know the communities. And then we start talking about diversifying our workforce, whether it's a public health workforce in a school, like a school of public health, or a public health workforce in a government agency, or a public health workforce of community health workers that liaise between the community and the academic institution. We need to diversify so that we can really get in there and together solve these problems. And as part of that, we come up with evidence that becomes policy. And the key thing about this roadmap is along the way, and you're all doing this, but along the way, we've gathered this incredible support group of people. And so when you're on Capitol Hill knocking on doors, which we've all been doing lately, we're not alone. We're with this whole group of people. And so I would say that my first philosophy of kind of how I got to the place I got is to have passion for understanding. And my whole focus again was on equity. How do we narrow the disparities gap? And then that's how it started, just with this identifying risk factors. Are they different? And then moving all the way now to building schools of public health, which now will continue always. It has to. We can't solve problems around disease in society if we don't focus on health equity. And we can't do that if we don't get everybody in that group involved. And so what you'll hear as I go through my slides is just how do we continue to involve people? Who needs to be involved? Who needs to support this? And I would say the second thing that I learned how to do on the ground was this community-based participatory research. What does that mean? How to create partnerships. And again, we start out in the community, but we move from the community to our schools, to our students, to our staff, and now we're going to have to use community-based or community-engaged research to work with our congresspeople, our governors, the president, his whole staff, everyone. And so what does that mean? And so, my experience is really being at a place where I can build trusted and sustain those trusting relationships, to understand people where they are, meeting people where they are at. And as we're undergoing this really unbelievable, unprecedented global health crisis, or crisis because there are those that want to sort of take down public health, and higher education crisis. We need to understand where people are at, meet them where they are at, and then bring them along. And part of that, again, is in this community research and community participatory research type of practice, is really saying, the value of our conversation is not just for me, the dean, or the scientist, but the value is for you and your communities. And if we don't have value there, then why are we doing this? It's not just, again, we're getting a lot of, I think, a lot of focus on academics as an elite community, but we have to go back in meeting people where they're at. And I have to say that I've had a lot of stories, I could tell stories for hours, about sort of community-based research. And so this is a picture of the Columbia Community Partnerships for Health Center opening in the middle of Washington Heights Inwood in northern Manhattan. And we did this in response to the fact that there were very difficult relationships between community and the Ivy Columbia University. And they had, unfortunately, Columbia's had a long history of not having great relationships with its community. And so after talking in the community with community members, again, this coming out of some really early work on stroke incidence, now I'm working as part of the Clinical Translational Science Award, doing community engagement. People wanted the ease of being within the university, within the community together, sort of this place where people felt that everybody was sitting at a table, that there was no power dynamic, and that people could talk freely. And I'm happy to say, so the good news and the bad news. The good news is this is still there, a decade plus later, still doing that great work, and I haven't been in Columbia for really a long time. But I'm going to tell you this one little story before going to the next slide, which is really, I think, important. So I'm sitting there and I'm in a community, at a community organization, and we're talking about everybody using this center. It had early computers, we had childcare, we did a lot of work on really informing communities and talking to communities about the health problems of communities. And somebody raises their hand and says, what was the address of that center? And I say, oh, XXX Fort Washington. I don't remember the address now. XXX Fort Washington. And they said, oh, yeah, I used to live in that building until Columbia evicted me. Okay? So the process of community participatory research includes reconciliation. We all carry baggage from our institutions, from our populations, from the communities that we consider part of ourselves. that have done bad things to people. And so part of this philosophy of passion and forward movement and community engagement is reconciliation. And so never being afraid to say, I'm sorry, that was a bad thing. We can do better. And so that's something that I carry with me. We have a huge shared governance model at University of California, Irvine. I'm not a perfect dean. No one is a perfect dean. No one is a perfect faculty. And sometimes we get things wrong. And so reconciliation, transparency, these are values that we really have to carry with us in leadership. Leveraging existing infrastructure. So I've built 2 institutions. I've been part of the building of NYU's Institute of Global Public Health, which is now a School of Public Health, and UCI's School of Population and Public Health, coming in when there was almost nobody there and moving these forward. How do you take something new and build it into something big quickly? And one of the things that you do is you leverage existing infrastructure. And so I want to just use the example really quick. NYU is an incredible global university. When we were building the MPH program at NYU, we used its global strength and came up with something called a cross-continental program, 1 year, 3 continents, 1 MPH. And so thinking about the infrastructure of your school, the infrastructure of your university, and the infrastructure of your community, and leveraging the strengths. So we're a big community engaged, researcher-focused School of Public Health now, because that was our strength. We have great relationships with the community, and our faculty are researchers in the community. So for us to choose genomics as our strength when we don't have the infrastructure to support that would not be a great thing to do. Adapting to lessons from the past 5 years. And so I mentioned the past 5 years, and this is where agility comes in. We all know, we've all been through how many different kinds of crises. And so I'm just using this very quickly, this example, and I'm mindful of time, of really thinking about how we jumped on the bus for COVID. So the first thing is, we had a chancellor who didn't know anything about COVID. None of us knew anything about COVID. So being at the table, being in there and saying this is a public health problem, we ended up running the entire public health response at our 50,000 person university, and actually in Orange County, 6th largest county in America, because we were at the table and we said, how can we help? What can we do? And one of the things that I had known from having community engagement activities going on all along was that our public health department for the county was well staffed for chronic disease, but poorly staffed for infectious disease. We had faculty, we had students, called them up on the phone, and again, we have a trusted relationship because we've already engaged in a participatory relationship, and we say, how can we help? What can we do? What don't you have? Well, they didn't have modelers, right? And they needed modeling. They didn't have students that could go out there early on and talk about education around COVID. And one of the problems, of course, for COVID is that we didn't know too much early on, but we did know some things. And so we could at least talk about some basic concepts and actions around infectious disease. And so we then start this response, and this spirals into this really, again, trusted relationship. It spirals into a number of different things. Because we were such a large county, the county ended up getting a lot of money to look at COVID surveillance. So instead of going out and looking at who's going to be able to do contracting, they already had a trusted relationship with us, and we said, we're dynamic, we're agile, we can do it, and we did. And so all of these things we build with flexibility and passion, we build up a whole infrastructure that supports not only a school, but that supports the county as well, and actually has led to something 5 years later, these great relationships called the collective on collectives, where the academic public health institution is acting as the liaison between community organizations and government. And we have a county board of supervisors, and the Collective on Collectives now stands to advise using public health evidence, data visualization, epidemiology and health policy experts to advise the county supervisors on important health matters. Prior to that, it was only their staffers who did this. And then, so this is just right, some of those things that we did. I haven't mentioned students too much, but I do want to mention very quickly, students are critical. They're the soul of our institutions. And one of the things we have to continue to do is to empower this next generation. And part of that is all of the things that we do every day, our curriculum, our training, our mentorship, but we must be responsive. These last 5 years have been very, very difficult, and one of the things that I pride myself in is always squirreling away some money so that we can be responsive. We can't always predict how we're going to need to be responsive, but we should be prepared to be responsive. And so because of COVID, because of the because of the Gaza-Israeli conflict, in the middle of Black Lives Matter, because of conflicts and issues around higher education, we have been very responsive in putting together in the course of a week or two, these really important training programs, advocacy 101, conflict resolution, trauma-informed care. So our students are getting education practicum plus, and they're getting these life skills, which, given the way that the world is going, they're going to need. And part of these kind of life skills, I think, really provides better resiliency. And then anticipating, too, in terms of our communication. We did big election debriefs, talking about the climate, the environment of our school, and being very transparent and open and communicating, town halls. And one of the things that we're doing, that you guys are all doing, is, again, support groups for faculty who have had terminations of grants or are feeling very vulnerable. And so listening to the needs of our students and providing them with skills and training to become resilient. And I would echo that we're doing the same thing for our faculty. And then 2 more quick slides, leadership and action. So agility, being able to rapidly respond to emerging health crises. When I was at NYU, we were approached by the UN. They said we need a behavioral course around polio. We were trying to eradicate it. As we were doing that course, which meant turning an MOU around with the UN, which is not easy, for an academic institution in 2 weeks, and then bringing all the folks in from the field, working with our students and these field folks together to teach this course, and being flexible at a moment to not just talk about eradication of polio, but at that time, talk about Ebola. And so we were able to do that because we were agile, we were dynamic. And I know that in some ways that comes as part of the institution that you're in. NYU wasn't as strict of an administrative bureaucracy as the UC, but in our leadership, we have to be open to being agile, to being flexible, to including everyone in everything so that we know what perspectives we're getting, what's going to work as we make our decisions. I still feel very strongly, and we did our 2nd strategic planning initiative this year, and we did it after the election, and our faculty all came together and said, we are still committed to a foundation of health equity, period. And so having this equity, centering equity, is the right thing in all initiatives in public health, even though it's not as easy to do it as it used to be. And finally, really important, communication is critical. Communicating with faculty, listening as part of that communication, changing the communication depending upon the needs of the communities that you're focused on, and getting out there and standing up. And I know that the leaders that you're going to hear from today have been very good at that communication. Challenges ahead, I think we're going to talk a lot about this. I think the key challenge is this anti-science dialogue. And really, we've got to get people to trust science. We are scientists at our core. We're scientists who want to try to change the world in a positive way through health equity. We need to be active listeners, active communicators. We need to advocate effectively for policies, and we need to engage in education about issues that affect us all. And that's it. Thank you.
Fired up. Thank you so much, Bernadette. That was really great, and I learned a lot. And thank you to Tom and others for inviting us to do this. It really is a privilege to be able to reflect on what we're doing as leaders. And especially, I'll probably end where Bernadette ended about meeting the moment that we're in right now. And I think all of us as teams are approaching this with an incredible amount of humility. That we are fallible too, but we committed to this because we believe so much in academic public health and in public health more broadly. So I just wanted to start though by introducing myself. And for me, introducing myself means introducing where I came from. So that's Ralph and Barbara Fallin, those are my parents, and I bring them up to start to level set a little bit. They both were incredibly accomplished people in their careers. Neither of them had a college degree or ever stepped foot on a college campus, and so I learned a lot about navigating even from the time of applying to colleges, through colleges, and then making it to graduate school, and then dedicating a life in an academic setting is really a far step from the kind of life that they led. But we have so much in common because they were also driven by a purpose, a willingness to work hard, and sort of seeing a vision that they wanted for their family, for their community. Those two are from rural Alabama and outside of Paducah and rural Kentucky. But they met, fell in love, and ended up in the panhandle of Florida. So I actually grew up in Fort Walton Beach, Florida, which is only about 3.5 hours east of here. And I went to the University of Florida at the time when Emmitt Smith played for Florida. So that's how old I am, a proud Floridian and Gator. And I went to South Florida. They were doing School of Public Health at the time. So I actually started my public health journey at South Florida. But fell in love with something called genetic epidemiology, which at the time didn't really exist at USF. So I never got a degree from USF. I moved to Case Western Reserve, where I trained with Robert Elston and Nick Shork, who were really, I think, giants in the field of genetic epidemiology. So I always like to include this because I do have an affection for USF and for the work that now is being done, and for the spread of other now schools and programs of public health in the state of Florida. And then right when I graduated with my PhD in Cleveland as the Floridian, wearing this huge big coat every time I was in the winter there, I did not know what I wanted to do. I thought, I could do pharmaceutical, this is like the genomics revolution time in 2000, or I could try academics, or I could try something else. And so I ended up choosing to go to Hopkins, thinking, well, I'll try the academic thing for a little bit. It's a good place to be from if I don't stick it out. And what happened was I fell in love with the whole thing. I fell in love with the freedom, the curiosity, all those things that comes with an academic career. But I also fell in love with the people I got to work with and the communities that I got to work for. And I just really had never realized how fulfilling that could be. And again, I didn't come from a family where this was part of their norm. And at Hopkins, I got to do a couple of things that I want to mention because they're relevant to my leadership philosophy and thinking and experience. And that is around 2013, two opportunities happened at one time. One was I became a department chair. At Hopkins, there's a Department of Mental Health within the School of Public Health. And around the same time, I also became a center director. And I think these are really important separate leadership experiences because a center director is really about pushing a particular topical research agenda. In our case, this was in autism and developmental disabilities. It's really about bringing folks from across the whole university together to think through how do we move the needle on research, in this case from a public health frame for autism. How do I support the faculty and students doing exactly that kind of work? But you're not hiring or creating curricula or any of those things. You're really in a lane of one particular topical area. The department chair was a different thing altogether. That was now learning and advocating for all the different areas of public mental health that our faculty, staff, and students were working on, getting to where I could learn a 30-second elevator speech for any one of my faculty members at any given time, because who knows who I might come in contact with that could be supportive of prevention of child sexual abuse or of fentanyl tests or whatever might have come up, right? So that was a different kind of exercising my leadership skills to expand my horizons in ways that I wouldn't have done in my own research and professional lane. And I loved it. It also meant I got to help nurture curriculum development. I got to hire faculty and help nurture their promotions and their own careers. So there's a lot of really satisfactory things in both of those worlds, but they're very different leadership opportunities. And so then I ended up in 2022, as Tom said, at Rollins, where I got to kind of put those two things back together, because you get to do both of those things in a dean's role, which is really great. But probably the most important thing about me is my people. So that's my husband and my two sons, who are now 14 and 15. This was at a National Academy of Medicine meeting, so it was fun to get to experience that with them. My dog, which is a very important part of our life. And then what you see on the left is my husband's family. He's one of 3 kids, all from Long Island. And we spend a lot of time with their families. And so when the National Academy of Medicine thing happened, both my mother-in-law and my mother were present. And so I think just shows like how we feel about family. But I mentioned these 2, and now 3, the department chair, the Wendy Clegg Center directorship, and now deanship at Rollins as kind of formative to leadership thinking. And so I'm going to say a couple things that are very similar to what Bernadette said, maybe using slightly different language, but here's sort of kind of the corners that I go back to in my center of gravity when I'm thinking about what I'm doing, how I'm doing it, am I being useful, am I being strategic, those kinds of things. And the first one for me, it starts with empathetic leadership. I was privileged to have exposure to other leaders who were very empathetic. We all saw in the case of COVID how important that was for the different ways in which we were all living our lives and our communities were. And I bring this up because I think we all want to be empathetic leaders. It turns out to do that intentionally is hard. And one of the reasons it's hard is because there is a sort of spectrum of empathy, and I understand you're having a really tough time, and I need you to really live in that space of toughness for a while, and how can I be supportive? We are also accountable to doing the jobs that we signed up to do, and so there is a spectrum of empathetic leadership and holding people accountable, and it is not trivial to understand where you need to be as a leader on that in different situations, and so I think that's a really important one for me. Bernadette mentioned this in a different way, inclusive leadership. And so I spend a lot of time thinking about how do I make sure that I have heard from all the people who should have input in this kind of decision before, even if it's only my decision and not a vote. If I'm going to make that decision, I want to be fully informed by your voices and how you're thinking about these things before I make that hard decision. And that's another one where I think of it as a kind of like spectrum that there are times where, as a leader, you have to make the decision in the next 10 minutes, and you don't have time for any of that inclusion, right? There are other things that might be transformational to a school or a program that you want to be as inclusive as possible and maybe even hold some votes, depending on what it is. And so that's on the other end. Usually we live in the middle on that one too. And so figuring out what is the appropriate middle that you are having this inclusive decision-making that's appropriate to the weight and the time scale of the situation. And then vision setting, which is related to that inclusivity, but it's one thing to sort of hear folks and make a decision, is another to then really create joint ownership for action. And so vision setting to me is not about one person saying, I've decided that we are going to be the very best school of public health in HIV research, right? It's have we all worked on that together? Do we think that's the right strategic thing to do? And if you feel that way, and if you've worked hard to help make that strategy, then you're more likely to want to step forward and raise your hand when there are tough things to do around meeting that vision. And then lastly, reflective. I am constantly sort of writing at the end of a week, what did I learn this week about this? You know, what mistakes do I think I made or we made as a team? where could we do better? Where do we do something really great? You know, that kind of reflective leadership that then allows for change. You mentioned this in the none of us are perfect. And I think being able to have that reflection and move forward has been valuable for me. I want to say a couple more just really personal things that I've learned through this. And the first is, I was told often, especially as a woman in leadership, that, you know, you can't have it all. You can't. And I think many of us, regardless of your gender or positionality, are told, oh, if you're going to be an academic, you're going to have to work so hard, and you're going to have to do this thing, and if you're going to do this, you have to do this. And what I learned early on is, like, there's no definition of that. You get to make your own definition of what that means. And so if I was intentional about describing that for myself, then, you know, I would feel more comfortable. And that was hard. It took a long time, and I don't know that I'm still there, so I'm continuing to learn this one. But I'll give you a little glimpse. So I spent a lot of time starting with introducing you to my family. That's even more important to me than work, although work is pretty important to me. My community that I live in and my friends, my own health, are really important. Then there are these other things that could be important that are just less important for me personally, but you may make a totally different calculation, and that's your have it all versus my have it all. So I show you the picture of the room. If you come to visit my house, which I hope you do, I would love for you to be at my house. It is not the neatest place in the world. We do not spend a lot of time on housekeeping. Positionality and identity themselves are important. Like I said, I am, you know, a white cis woman, and that's my experience in leadership and how I show up and how people perceive me when I first meet them. Each of you is a leader in the work that you're doing, and you show up with those different multiple positionalities and identities in what you do, and it matters because how we interact with people, how people respond to us will depend on that situation. So for me, the most salient of those really is the three that I just said. I show up as a white cis woman. And so some of the things that have been really valuable for me in that is that I've developed a set of peers that had similar experiences. These are the three women that I now spend a lot of time. They're at different institutions now, but we were all at the same place at one point at Hopkins. And we text each other. I'm thinking about doing this. Is this crazy, or is this smart, or, you know, or just venting, or, you know, all kinds of things. And that becomes a real support network as a leader. Because it is tone deaf to complain about certain things to your leadership team or certainly to faculty, staff, or students. That would be inappropriate and kind of icky in many cases. But there are sometimes places where you need to vent or say, I need to figure this out, right? And so having that community has been helpful. I think that positionality is also illuminating. I don't know if I'm going to have time to tell you this whole scenario, but one of the things that was so meaningful to me in recognizing this was I did a kind of mentor-mentee workshop over a decade ago now, and we were role playing. And one of the role playing was somebody got a script that was as the mentor, and someone else got a script that was as the mentee, and you didn't know what each other's script says, right? And the mentor script was, you know, you have this mentee that you think is really great, but they're starting to not meet deadlines, and now they're supposed to write this, you know, editorial for this big journal, and they haven't met it, and now your peer at that journal is talking to you and being like, what is going on with your person, you know, and so what's the deal there, right? And then the mentee, their script says, you love your job, you've been working so hard, but your mom got really sick, and you're the only one in the family that's able to take care of her, but she lives out of state. And so you've been going back and forth, and so some things are sort of slipping, and you're not sure how to manage that, right? So they all do this, and then we do a debrief at the end. And so they asked, of the mentees, how many of you in this conversation said you were taking care of a sick mother? The men who were role-playing as a mentee, the women who were role-playing as a mentee, 0. Really illustrative. And it was a moment where they were like, what do you mean you didn't tell? Why didn't you tell? You know, and so it was a learning situation. And so I just give that as one, you know, type of aha moment. Again, from my perspective in the world that I live in, each of you might have some story like this of your own that is, I think, useful as we then think about how we show up as leaders. So that's why I bring that up here. And then lastly, I learned early on for me that living in a positive culture, having flexibility, all those things in whatever position I'm in is much more important than most other things. And so I spend a lot of time trying to make sure that our people are thriving in what they're doing, whether you're a student, a staff member, or a faculty member, that you feel like this is the most positive culture that you could live in. Because it may not be the most financially lucrative. Although I don't know that's always true. So then I just wanted to end with meeting this moment. So this is a slide that we, as Bernadette also has been doing, and probably you also here at Tulane, we've been hosting town halls almost weekly since January. There's a lot of reasons for doing that in person rather than also doing other kinds of communication styles. But it's been really important to do. We do it with faculty, staff, and students, sometimes all together, sometimes separately. But this is one of the slides that I often start with and keep updating. And I think it's just to set the context. Right now, we're all grappling with the consequences of hundreds of executive orders, of multiple agency directives, of funding and personnel reductions in those agencies, of our own grant terminations or non-renewals or other kinds of things that are happening with federal funding relationships. And those geopolitical challenges that were really a challenge for most of our campuses in the last 2 years haven't gone away. Those things exist as well. So we're really adding, a lot of difficulties for our whole communities, our faculty, staff, and student communities, as well as the communities that we work with and for around us. And they have lots of impacts. I'm not going to go through each of those, but I just wanted to acknowledge that there are these impacts, including, I will say at the bottom, reputational, particularly our global reputation. And so many of you who do global health work, we've spent a lot of time in the last several decades building mutually beneficial relationships where we are uplifting and building capacity with our partners. We're hard pressed to be responsible partners in terms of money flow, in terms of getting all those things out the door. And now we've really dialed that back because we pulled out from under a lot of our partners. And that's a tough thing for us in global health. And then morale, I'm sure you all are experiencing it here, but some faculty members have lost their entire portfolios overnight, and that's something that we have to grieve and then help lift up to figure out what you do next. And then in our entire public health community, we're uncertain about a future, and uncertainty is anxiety-provoking and really tough. So I'm really proud to say that all of us, as being part of ASBPH, are part of a Public Health Now more than ever initiative. I think what we can't do is live in this, as you said, keep walking, don't sit down. This is a moment for public health, and it is really hard right now. But the work of public health isn't going away. Those needs, the reasons that you are in this room today, that you chose to do this as a career, still exist, and in fact could be exacerbated in some parts. And we're going to be part of shaping what that new future looks like. And it will be different, but we're the ones that have the privilege of being able to help do that. So leading in this particular moment, just a couple of silly bullet points that I think about a lot are this frequent engagement. Like, this is not a time for leaders to sit in the back room and not be in faces with folks, even if I have bad things to say, or even if you have bad reflections to get back to me. I'd rather be there and hear it and talk it through than leave you on your own to fill in some gaps. I want to help you advocate publicly and privately. Some of the backdoor government affairs stuff is necessary and is private, but there are a lot of things that we should also be doing as individuals and as institutions publicly. We continue to acknowledge the psychological distress and uncertainty because it's real. I, in this leadership role, am really thoughtful about the different needs across the landscape of stakeholders. And what do I mean by that? I mean, what our community partners need, because they are also suffering and also worried about 503C status and all kinds of other things, right? How I, as a dean, show up for them might look different than how I show up for our students, than how I show up for our staff, who are very worried and feel very vulnerable about their jobs, particularly research staff, versus our faculty who have their own concerns. And then, how do I show up when I'm talking to peer deans and arguing the value of public health within a university setting? How do I show up to our own president? And then how do I show up to others around? And there's just differences in each one of those, and I think a lot about that. The last little bit is being honest, even when I have really bad things to say at this moment, but also not catastrophizing. Some of the things that we want to spiral through, aren't helpful. But we also aren't going to sugarcoat. And some of this comes from my mental and health and public mental health training of cognitive behavioral strategies that we got to check ourselves and, of course, sort of reality test some of the things that we're saying and thinking in our heads. Bernadette already talked about building and nurturing relationships. Continue to celebrate wins. I've noticed a little bit of folks that are like, I want to, like, graduation. I want to celebrate graduation. Oh, but there's these things going on, And I think understanding that both things can be true. You can be sad about the situation for some aspects of public health and still celebrate the excellence and the joy and the impact that you as a student are making, or as a faculty member, or as a staff member. And then lastly, continuing to lean into purpose. Like, public health is powerful. It's still powerful. We are going to do and doing already great things. And then just in the same place that Bernadette landed, we are fundamentally anchored in public and health equity. There's no separation. That your day one of epidemiology classes talks about distribution, right? What do we mean by distribution? We're finding out who, where, and what they have. And then we're working on that. And that who, what, and where informs what we do. And so it is impossible to not think that way and to not want truly equitable access and benefit from the work that we do. And I think I'm out of time, so I'm not going to say much more other than to say some of the critical areas that I've learned from this are we got to push dialogue and communication skills. Bernadette talked about this as well. We've really been pushing different kinds of training across faculty, staff, and students. We have an ambassador program amongst staff and faculty to do this work long term, and we're having all of our members of our Rollins community engage in small group dialogue practice, where you're really living in uncomfortable situational dialogue in small groups, so that we can build that muscle, because that's what we're going to have to do to move forward and reshape things. And communication. That's interpersonal communication, the previous one. This is about external communication, and I think all of it is just incredibly important. And I'll stop there. Thank you so much.
Thank you both for that. So typically we are rushing to get out by 1 o'clock because students have classes at 1. But this is finals week, so assuming we'll have less of that. So we're running a little bit long, and we'll take a little more time. So we'll go a little past 1. If you need to leave, of course, be free to quietly leave without disruption. But I'm not going to spend too much time asking my questions, though I do want to open up to the audience. But I did want to ask you to talk a bit about, you ended by talking about being the moment. And in the role of dean, you have to be thinking about leadership from at least 2 perspectives. You're thinking strategically, you're thinking about where the school going to be 1 year from now, 5 years from now, 10 years from now, 50 years, 100 years from now. You're thinking about that. But you're also thinking about the here and now, like you have problems and issues and things that you have to respond to right now. And right now we are in a unique period for our field. And it occurs to me that the 3 of us are in different places from that perspective, and that we are, I believe, the only public health school at a private university in a red state. You are in purple state, and I'm going to call you purple because you have 2 Democratic senators, so you're purple, and you're at a state institution. So I'd like to end in a very blue state, right? That has a lot of Republican voters also.
That's right.
I'd like to have each of you kind of talk a bit about what that has been like in terms of your engagement with your government relations, your congressional representatives. Kind of what has that been like, and how have you been approaching that from a leadership perspective?
Yeah, I think that's part of this, like, really training and practicing dialogue in these challenging conversations and moments, because to effectively communicate to a representative from rural Georgia who has no real interest in what's happening in Atlanta, right, is a critical skill. And in fact, we've all known this in public health forever, particularly in global work, that kind of active listening, meeting folks where they are, coming prepared with the right information that's relevant to who you're talking to. I would not come to that conversation with someone in rural Georgia with Atlanta facts. I would come with what are the rural facts and then listen to what are they interested in working on together. So I think that kind of building those skills is a critical area for us. And I've seen it more, I've seen the opportunity to flex those muscles more in Georgia than I did in Maryland, for example, which is much more of a blue state.
Yeah, I totally agree. So we're sitting, as I said to some folks when I went from New York to California, I thought, okay, I'm going to the bastion of liberalism. Wow, there are all the things that I can do. But I'm at the University of California, and there are 10 schools that are part of that. It's a very powerful academic community. But because it's so large and so bureaucratic, it's actually much more conservative. And really, the steps it takes, there's lots of consultations with legal, and so I'm saddened to say that we have had to do a lot of sitting and waiting. But in the meantime, we've been putting together, as you talked about, our narratives of what public health is, why public health is so important to everyone, everywhere. And then the other kind of the constraint that I've had, in some ways I would love to just come to Louisiana and just talk with, your politicians, because we can't even speak with our politicians because we've all got to have the same very kind of neutral line. University of California, Irvine is in Orange County, as in the Housewives of Orange County, as in probably the bastion of conservative thought in California. And so we have this very active board of trustees. And so it's really been very much a challenge. I'm actually heading after this to the Hill to talk to everybody in California, hopefully and beyond, to try to give them some perspectives. But whether you're in a more conservative or less conservative state, I think that the stories, the narratives around public health are really the way that we move forward and getting everyone to understand the importance of public health in their lives.
So tell me, what is your analysis about what happened to us as a field? So in public health, we certainly lost a lot of esteem, a lot of respect that we had. We certainly don't have the same voice of authority that we once did. And we get a lot more challenges now, especially from people that are outside of our field. What happened? And how do we fix this?
I think we got caught in a really bad place. So first, COVID was bad, right? We lost a lot of people, and it was a new infectious disease that people weren't quite clear in the beginning how to treat, how to stop transmission, etc. And there were probably a couple of ways to handle that. But I think what's really resonating, at least I hear in communities, was just the total loss of control that people had. I likened it to World War III. And I think that so we have this period of time where people lose control. Some people lose jobs, some people lose family, some people lose both, but they don't have the autonomy that's associated with being a citizen of the United States. And so they blame that on public health. I think that's one thing. And then the second, as we came out of COVID, and I've really thought about this a lot, people were depressed, mental health, a huge problem. But we didn't acknowledge it. I went to the chancellor once and I said, this is a campus in recovery, and we should be talking about that. We should be talking about how people transition back to autonomy. And the chancellor, who I have great respect for, said, no, we can't do that. And it turns out that over the year or two after, we did finally do that. But I think we have to acknowledge the terror and the loss, and you talked about grief, and the grief that people have and are continuing to experience. And so when you're grieving, you are angry. And so they're taking it out on public health. And they're taking it out on science, because it didn't save them, and whatever they lost. And so I really think that, and looking forward, we have to be transparent, we have to communicate, and we have to go back and build that trust. And I'm not really sure exactly what that's going to take, but it's going to take getting out there and talking to people.
I would echo a lot of what Bernadette said. I think there's two things for me. One is we have to do a better job as communicators, as individuals, as institutions, as particular programs. And so we saw that even in a time of COVID, where for multiple reasons our communication as a field of public health was not great. Some of it was communication skills, some of it was administrative misalignment. But that communication is just critical, and we have to do a better job as a field. The other is, and this is related to public health and also to the higher ed challenges right now, is we have to get over ourselves. Our smugness about what's right versus not right is problematic. It is not humble. We are not taking what we teach in other contexts as cultural humility, we are not taking that seriously when it comes to our communities of fellow Americans. And so we have to figure out how to do that better. That does not mean capitulating to incorrect information. That does not mean that. But it does mean actively listening to why a mom of a 2-year-old would be scared to vaccinate. It does mean listening to why someone, doesn't understand right now why we're still worried about HIV. Didn't we solve that, right? As offensive as I might feel both of those statements were, I would rather listen, hear where they're coming from, and then talk through the sort of human, here's the evidence, here's what's happening. And I'd rather us to all build those skills of active listening and effective persuasion rather than what we've been doing, because it's not working. So those are the things that I would add to what you said.
So right now, I'm really concerned about early career faculty, postdocs, fellows, graduate students, people who are training and making a decision about whether or not they want to have a career in academic public health. What do you tell those people? What do you tell people at that point where they're still deciding, is this really the right direction?
I say, I first ask them, what is it about this that interests you? Why did you come upon this field? And then let's talk about that passion, whatever that is. I can guarantee you that work is still out there needing to be done. And your commitment to public health as a career in whatever sector you ultimately work is not a year-long commitment, it's a lifetime commitment. And so that work will continue to happen over a lifetime despite some immediate ups and downs. And I don't ever want to minimize the concern of immediate ups and downs. We want to be employed, we need, all those things are absolutely true. But I think choosing this career and to dedicate to these problems that are not yet solved, and like I said, could potentially get exacerbated, is a great thing and will pay off because those things need to be solved and will have to be solved as we move forward.
Do we have any questions from the audience?
I have questions. Thank you so much for your wonderful presentation.
Well, we need the mic because we have people online.
Thanks so much. I just want to say thank you so much for your really wonderful presentations. They were excellent. So you talked a little bit about mis and disinformation, and it feels like daunting. Like I can talk to one person and I can explain, I can say why we need vaccines or, what are your concerns about it. How do you get to the greater population? The mis and disinformation is just, I don't know how to handle it. Thanks.
Sarah, you want to start?
Yeah, I think we've all been thinking about that, right? So the first thing, of course, we're going to start with our students and ourselves. And we talked a little bit about this earlier, but every Thanksgiving table should have an advocate for science. And so that means that we have to make sure our students are trained effectively. And I know Emory's got some incredible programs going on around this. And I also think that, thinking about not just our master's students, our undergraduate students, our doctoral students, but sort of a snowballing effect. If we could commit to talking about science and misinformation, disinformation at college campuses so that we're sending everybody out in defense of science. It doesn't even have to be public health science per se, but let's start with science and then make the connections. And then I think we have to do this in grammar school. I think, basic health courses, we've got to get back to the basics. Remember civics? I mean, I wasn't even born when they had civics, but but civics was a way to sort of talk to people about how to behave, right? And I mean, disruption is important and great, but I'm talking about why can't we talk about science and have a greater dialogue in town halls, in communities. We're not having the misinformation at college campuses, in sort of the academic elite, which we want to try to get away from. But we need to bring the dialogue out into the communities and our community organizations and our students, and we need to create a generation, again, that trusts science.
Yeah, I'll just add two things quickly. One is exactly this point about we need to be able to have these conversations in our communities, in the multiple communities that we have. And we are doing less of that over time, partly because of COVID, partly because of just secular trends, and more happens on social media, and you're more likely to say something on Facebook than you are to the person that you're sitting in front of. Like that discomfort of looking someone in the eye and saying something that they don't believe and trying to talk it through, right? So we can't give up on that. And in fact, we haven't really even experimented with it because we stopped doing it in the same ways in the past. So I really want to emphasize that point. But the other thing that I think we have to recognize is we did this poll with Gallup after the election but before inauguration about what Americans want for the next administration in terms of health. But then in that poll, we also asked across all the U.S., what are your trusted sources of information? And number one was still your healthcare provider. And so one thing that we're missing out on is a really intentional training and campaign of all the different care providers that touch our communities. They are not public health advocates or strong communicators, just like we're not. This is not antagonizing our peers in these different provisions, but none of us have really exercised these muscles well. And so that, I think, is an opportunity where we can work together. We can work with medicine, nursing, PT, all these different things to have a curriculum that helps to promote that kind of language and education in addition to these individual conversations.
There's a question back here.
Thanks so much for taking the time to come and speak with us. Very inspiring. I like the idea about the frequent town halls. That was excellent. I've had interaction with some students recently that are a bit disheartened, trying to find a position or have lost positions because they're low man on the totem pole. Do any of the three of you have some good suggestions for us on how we can encourage these students, and also maybe some direction that we can point them in?
We've talked about this a lot. I think that there's a couple of things, and this is where leadership is probably really important. One of the things we probably have to do is create pathways. And so one of the things that Danny and I were talking about this morning was that the students have organizations that they want to work with and for, and others that they don't, right? So, you've gone to the dark side if you're in pharma, for example. But I think that's unfair, and I think we as leaders have to recreate that vision. There's a lot we could say and criticize the pharmaceutical industry, but they are still, developing treatments that are life-saving. And more than ever, they want to work with communities. They want to understand what communities want, whether it's to do with marketing, which I know, is the dark side again, or whether it's to do with delivery, right? What's the delivery method that's better for particular communities or members of communities like, postpartum mothers. So I think that we should be open to providing our students with options and opportunities at the same time that we all create a better pipeline to all different kinds of organizations, because every organization needs a public health person.
Yeah, that's a lot of what we talk about, is this bucketing of what are the honorable things to do next versus the selling out or something, and that narrative has got to go away. There is an impressive amount of impact can be made in every sector if you have a public health mindset, and so continuing to elevate that point is just so critical. And then something that you were saying, Bernadette, triggered something else in my brain, but maybe it'll come back to me. Yes, that's exactly what it was. One thing to ask your students to do, and I think one of you said that you already done this advising just today for one of your students, but that we talk a lot about at Emory is, what are the critical skill sets that you have learned while you've been here? Usually they start with, data analysis, odds ratio, I don't know, something like that, yeah. And then 2 by 2, right? But then they'll, expand and say, actually, it's more about critical analysis. It's more about data visualization. It's bioinformatics tools. It's program management. You go on and on and on. There are so many skills that our students in a Master's of Public Health program, for example, and many other programs as well in a School of Public Health, are getting that are transferable to any field. I would challenge you to tell me any sector that wouldn't benefit from someone trained in the way that we train people. So I think really getting that message out, not only to our students, but to our community. So I'm spending a decent amount of time right now actually showing up to Chamber of Commerce and Rotary meetings to talk about the value of our training for people's teams, regardless of what they're working in.
I couldn't agree more. Yeah, I say all the time that there's really no one who's really capable of being the dean of a public health school, because it's such an eclectic place. I mean, we've got people here, we've got attorneys, we've got engineers, we've got physicians, we've got sociologists, we've got psychologists. I mean, you name a field, and we've got somebody in this building who's trained in that discipline. And that eclectic sort of educational experience, I think, lends itself to our graduates working in basically any environment. And if you look at where our alums are, they're working in every imaginable field. So, Celia Scott Leatherhead she's in theater.
Yeah.
Explain that, right? Because everything touches public health. Everything affects the health of the public. So we're needed everywhere. So, any other questions? I know we're running along, but I like these sessions, so I'm gonna keep going. Yeah.
Maybe I can use this microphone up here, I'll be faster. Is this working? Oh, I'm passing.
Yeah, thank you both so much for being here, especially in our weather that we're having today. This is really a question for our students that are in the crowd and listening. I don't know any of my colleagues that had a dream since they were 5 years old to be a public health worker or to be a dean, right? And public health is really kind of amorphous. It's really hard to describe because I tell everybody it's everything. You go to nursing school, you get a nursing job. You go to pharmacy school, you get a pharmacy job. And just listening to your backgrounds, which is really always fun to hear everybody's backgrounds and how they got to where they are, the road has been very different. And what were the guiding principles, or what advice can you give to our students who are, coming out now in a tight job market about how to make decisions? Like, how did you land on your feet? How did you find your path?
Well, I would just, I said it before, and I really want to echo this, and that is finding your path. Your path needs to include passion. If you are not passionate about the work you're doing, don't do it. And I remember when I first got asked, because I was the only one at the time who had gone out into the community at Columbia, if I would run the community engagement core of this Clinical Translational Science Award. And I was an early career faculty. And every single person, from the dean to the chair to my colleagues, said, do not do this. You will never get tenure. It will be a dead end job. And I thought about all of it, and I said, you're probably right, but it's the right thing to do. And it was passion. And I have to tell you, I fought on tenure. It wasn't easy. They were right. But I think all of those things then led me to bigger opportunities. And I am tenured. But I'm saying, I think passion, and also doing what you can do. But I think it's okay that you don't have everything planned out. I don't think either of you had everything planned out in your life, right?
Well, thank you.
Yeah, I think that's right. Be prepared,
Right.
but seize opportunities that will come at unlikely times. And yeah, if it speaks to you, jump in.
And these are unlikely times. So taking something in a place you think doesn't understand public health you could be the trailblazer, right? This is, as difficult it is, and I love your Celebrate the Wins, as difficult as it is right now, there will be opportunities. Take them, because they could lead to such unbelievably great things. And if you don't take them, you'll never know that.
And in the spirit of celebrating the wins, we will be sucking money after graduation next week. And we're going to continue to do all the traditions that we normally do in spite of the challenges we're facing. Thank you all. Thank you for coming here today, and thank you all for attending this session. This is the last of our in the series for this year, as we are in the semester. However, we will be continuing this series next academic year, and I hope that you be joining us in continuing to participate in this session. So please, one last round of applause